Our lovely patient who's 41 years old is 2 weeks out from a umbilical hernia repair and a modified float tummy tuck. And she's coming in today in her regular follow-up, and she's very graciously agreed to share some of her thoughts and feelings as well as apprehensions for what she was hoping to do and how she feels so far.
So I think coming into this, I was very scared, but was looking for somebody who was going to not only just think about the cosmetic aspects, but also the functional aspects of the procedures that needed to be done, and was very kind and reassuring. I thought that the team was very good in making sure that all my needs were met throughout the course of the treatment, and I'm very satisfied with the results. Actually, they were beyond what I could have expected, and my recovery's been a lot faster than I expected as well, and just looking forward to not having put the whole process behind me, but also just very grateful that things turned out the way they did.
Well, you're so wonderful. Let's go back to the beginning when we first met and we were sitting and talking about your hopes of addressing your umbilical hernia and getting a flatter tummy. What were some of the things that you were apprehensive about, and were we able to address them?
I was worried about the pain of the procedure. I was worried about the recovery process, how long I was going to be disabled from the process, how much help I was going to need at home. And I think it's difficult to fully address all of those things completely before a procedure, but I certainly can say that they were that I think a lot of my fears were unfounded, that it was not nearly as bad as I thought it would be. And so I think that I think I'm very grateful for that.
I love it. Did you feel that we anticipated the issues ahead of time and let you know what the plan was so that you were well prepared?
I think that when I voiced different concerns and talked about my objectives, I think that you were very responsive to it and were able to tailor what you were going to do based on what my priorities were. And I didn't really have to push or advocate for myself that much in that regard. Great.
Well, that's what we try and do. You know, the thousands of these that I've done, I really have a very good idea what your experience is going to be like. And so I try and get the team to educate you and have you prepared at every step of the way so that there are no surprises. So thank you so much for that. Here we are at 2 weeks, and I like to tell people that you should be at 50% of your activity. Would you say that's true for you?
Yeah, I think definitely I'm at 50% or potentially maybe even a little bit more, but just feeling really good and just being careful and cautious, trying to respond to how my body's reacting to different things. But yes, I would say 50% activities is definitely a very reasonable goal for people.
Perfect. And did you drive yourself in today?
Yes.
Yeah. And that's generally what we find, that your family drives you in at week 1 and that most people are able to drive themselves in at week 2. And I think that really, really illustrates how quickly you're able to recover. The other thing that I like to have people hear about is that we do not use drains. Is that something that you had thought about or was part of your algorithm?
It was kind of more of an afterthought, but I like the rationale for it, and I feel like it goes together with someone who's being very careful about their surgical approach and has given thoughts about what the recovery from that approach is and the different decisions that are made in the OR, what the consequences of that will be in the recovery process. So I think it does require a certain amount of skill and knowledge and experience that others may not be able to offer regularly. The drains themselves didn't necessarily scare me because I think they could be managed, but I think it just goes along with the whole operative approach.
Yeah, you're absolutely right, and I'm glad you were able to appreciate that. It is an entire philosophy of accelerated recovery and unencumbered, and certainly the drains slow you down, and they're totally not necessary. I haven't been using them for 15 years. So the final question I'd love to ask, if you were talking with a friend, is this something that you would recommend to them?
I think if somebody was considering whether to do the procedure or not, based on my experience, I would recommend doing it. I think I chose to do it on an earlier side because I had heard from other people that it was the best thing they could do for themselves. And I don't regret making that decision, so I would certainly share that with a friend.
That's fantastic. Well, thank you so much for sharing your journey.
Thank you.
Isn't that fun?